Hello, I'm Dr. Matthew Bovenzi, Assistant Chief of Primary Care at the University Eye Center and Assistant Clinical Professor here at the SUNY College of Optometry. As we remain open for emergency and urgent care, I wanted to take some time to discuss what might actually constitute an urgent visit, a reason you might need to actually come to the clinic for eye care during this COVID-19 pandemic. During this time, it's important to follow expert medical advice and stay home to minimize contact with others as much as possible. This will help to slow the spread of the virus and keep our hospitals from becoming overburdened, keeping you and others safe and healthy. However, there are certainly emergencies that may require an in-office visit. First, let's talk about red eyes. Red eyes, or pink eye, as some call it, may seem like an emergency. However, most red eyes could probably be diagnosed and managed with telehealth visits. That is, visits over the phone or video chat where you can talk to a doctor to discuss your symptoms. If red eyes are associated with itching, it's often just allergies, and a simple anti-allergy drop, either over the counter or prescribed by your doctor, can help. If there is discharge associated with the redness, pay attention to it. Is it watery? If so, any infection is more likely to be viral in nature, and you'd have to let it run its course. If it's white, yellowish, and pussy, that's more indicative of a bacterial infection, which would need to be treated with antibiotic drops. But again, this could likely be diagnosed with a telehealth visit and medications prescribed electronically if necessary. The UEC is offering telehealth slots to care for these kinds of patient complaints. Now, if the redness is associated with an intense, boring eye pain that feels like it's coming from inside the eye or increased light sensitivity, this should be examined in office, as it could indicate inflammation inside your eye, which could only be diagnosed and treated appropriately after an in-person examination. Swollen lids are an emergency if the entire lid is swollen, particularly if associated with fever, loss of vision, or other symptoms. If just one part of the lid is swollen and tender, though, it is likely a hordeolum, often called a stye, which is a common condition and is an infected oily gland in the eyelid, which can be treated with frequent hot compresses. A telehealth visit would likely be enough to diagnose and manage this condition. Any recent onset decrease or loss of vision is an emergency and should be examined, especially if you have an underlying systemic disease such as diabetes, hypertension, or high cholesterol. The same goes for recent onset double vision, new floaters in your field of view, which are black spots that float and move with your eyes as you move them, and experiencing flashes of light. Any of these could be indicative of eye conditions that need urgent management and would warrant an in-office visit. While it is also possible they could indicate more mild pathology, the only way to know is with an examination. Slow, prolonged changes in vision over time are more likely to be due to changes in your glasses or contact lens prescription, or the development of cataracts, which are not emergencies. It is best to wait for the COVID-19 pandemic to subside before scheduling comprehensive exams to address these issues. If you have an eye condition that you are being followed every few months for, such as glaucoma or diabetic retinopathy, you should contact your eye care provider to determine when you should next be seen and if any medications can or should be renewed. At the UEC, each provider has been looking ahead at such patients and rescheduling exams on a case-by-case basis. Importantly, if you do have an ocular emergency, I would recommend not going to a hospital's ER or emergency department or even city urgent care clinics to have it handled. They aren't specialized in eye care and also need to prioritize coronavirus cases and suspects at this time. Instead, it would be better to contact an eye doctor who is open for urgent and emergent visits, who could give the appropriate medical examination, care, and management that you need. Stay safe, stay healthy, and stay home when you can. The University Eye Center is here for any eye care urgencies or emergencies that may come about. Please do not hesitate to call us if you have any concerns, questions, or worries. Thank you.